Lila, our little 10-week-old kitten, came in today for one of her regular routine wellness visits during her kitten series, if you want to call it that. And each opportunity that Lila comes in here, we perform a very thorough physical exam. We're looking for some things specific to kittens. Take, for example, ear mites in the ears, which in Lila's situation are nice and clean and dry. We want to make sure that there's no abnormalities with her bite, or there's any teeth that might be loose or needing to be pulled. We do a good overall physical exam looking for lymph node enlargement, might indicate a infectious process. We'll listen to determine whether we have any abnormalities that were associated with maybe some congenital or heritable type traits. And in Lila's situation, she is one of a litter that was born with, 2 out of 3 of the kittens was born with only a portion of her lower right rear leg. It's an abnormality that she was born with. It was not a traumatic event, and we have the history on that, so we know that it wasn't a dog bite or a car had gotten run her over or anything. And in actuality, the owner of Lila, his initial response was that she didn't want poor Lila to have to go through with living with this, essentially a portion of her leg, and initially it asked about amputation of the limb. And fortunately, we were able to convince her to let Lila go at it, and now consequently, obviously, Lila is fine with 3 3/4 legs. But overall, we do a very, very thorough physical exam. But our number one thing that we do when our patients bring in young animals, dogs and puppies and kittens, is to start educating our clients to make them a better pet owner. And by meaning that, everybody has good intentions, but our goal is to educate them from parasite control, because many of the parasites that dogs and cats can get, or we actually are potentially at risk. They can give what we call zoonotic diseases to us. We want to prevent most of our diseases, including heartworm disease, which is something we'll do in cats and dogs. And overall, we want to talk to them about house training if it's a puppy, litter box management if it's a kitten. We want to talk to them about behavioral consultations. Nutrition is a major component of what we do in young dogs and cats. And it sets us up to educate our clients so that that human-animal bond that we all reach for is as strong as it can, so that if we don't educate our clients from the beginning of their first 1, 2, and 3 visits, we take the risk that this pet is not going to be quite the family member that we want them to be. And so it's a very, very important aspect, and it's an obligation for us to help teach our clients to take care of the pets that they brought into their household. Many of the things that we talk to our clients about with puppies and kittens are across species, but there are specific things. There are some specific parasites that dogs may be more prone to. There's certainly the issue of house training a puppy versus a kitten, because that's much more of an onerous task than teaching a little kitten how to use the litter box. But basically, it's all much of the same aspects. Now, there are breed-specific things. If we have one particular breed of dog where we might specifically look for a heart disease that is common in the breed, or an eye problem that is common in the breed. Certain dogs are more prone to skin problems than other breeds. But basically, our early visits, our well visits as a young pet, are very, very similar between a dog and a cat. The idea that we need to see these dogs and cats back in on a regular basis are paramount for us to help prevent diseases. And our goal, at least in a general practice setting, is truly to be preemptive. Many of our aspects of pet care and disease processes are preventable issues. There's a couple of things that we want to make all of our clients understand on our wellness visits. There's going to be a period of time where a whole host of questions are asked, and there may not appear to be a reason for that particular question. It may not make sense to the client, but it's going to help us put the puzzle together. And even a healthy animal, we need to ask all those questions. But more importantly, if we don't ask the question that you think that we need to ask, please volunteer that information to us and give us as clear a picture as you can. So understand that our goal is to educate you as a pet owner, and it's a very, very important aspect of what we do. It's not just to react to a problem. We are truly trying to prevent that, many of the situations. So we value the input from our clients, and we require it. It helps us to finish off that treatment plan that we might be thinking of. It might help us select a diagnostic plan that we want, and the input from our clients is very, very important. When we ask the question, is your pet drinking more water? That may seem, well, it's summertime, yeah, of course he's going to drink more water, but it may be an indicator that the pet may have a diabetic condition, there may be a kidney disease problem. So any of these questions are very, very helpful if you'll follow through and work with us as we go through a set of circumstances. And we may ask the same question 2 or 3 different ways, and there's a purpose for that as well.